President, I come to the floor today as someone who has practiced medicine in Wyoming, Casper, Wyoming, since 1983. An orthopedic surgeon taking care of many of the families of the great state of Wyoming. And I come to you to talk about the health care bill that has been signed into law and to provide a doctor's second opinion about what is now the law of the land. I come to you as someone who has worked very hard for many years working with preventive medicine, working with early detection of problems as the medical director of the Wyoming Health Fairs, a program designed to give people information to stay healthy and keep down the cost of their care. So I come to you with a second opinion today on what is now the health care law, because I believe that the goal of health care reform should be to lower costs, to improve quality, and to increase access to care. Unfortunately, the new health care law, in my opinion, is going to be bad for patients, bad for providers, the nurses and the doctors who take care of those patients, and bad for the payers, the people that are going to be paying the bill, the patients as well as the American taxpayers. So I come to you because I am concerned that the health care bill signed into law is going to increase the cost of care, provide less access to care, and is going to lessen the quality of the available care in this country. Now, Madam President, I come to you with new information that has come to light on the health care bill. And specifically, I come with an article that was in Politico on just this Monday, May 17th. It was written by Kathleen Sebelius, who is, as you know, the Secretary of Health and Human Services. And what she said in this article is, we're collaborating with states to set up federally funded high-risk insurance pools to make sure, she says, that the Americans with the greatest need for health insurance will be able to get it. Well, Madam President, you know as well as I that there's an old phrase in politics that goes, how does it play in Peoria? Peoria, Illinois, what is the average American thinking about this? And with regard to this health care law, it is not playing very well in Peoria. Peoria is a place that Bill Clinton referred to when he was running, George W. Bush, Ronald Reagan went there, Barack Obama, when he was a candidate and president as well, went to Peoria to talk with people. But yet when you look at what the Peoria Journal-Star has reported about this health care bill and now law, in the president's home state, in a place that is felt to be the bellwether for political thought in the country, Peoria, Illinois, well, the verdict is not good about this health care bill, now health care law. And I'll start with an article that appeared in the Peoria Journal-Star that talks about what is happening in Illinois today. It says, for thousands of Illinois residents who pay high health insurance premiums because of medical problems, the new federal health care legislation won't offer relief, will not offer relief. It goes on to say the 16,000 residents who already pay into Illinois' high-risk health insurance pool, they will keep paying high rates, while others who enroll this summer under a new similar program will get coverage at lower, more reasonable prices. Well, what happened here? It says only the people, and this is one of the fundamental flaws, only the people who have been uninsured for 6 months are eligible, Madam President, meaning those in the current state pool can't switch and save money. Well, how do the people of Illinois feel about this? How is it playing in Peoria? Playing quite poorly. Julie Kramer is quoted in the article. She's 53, and she is feeling, as in her words, a bit cheated. Cheated, Madam President, by this health care law. She has paid high premiums for nearly 7 years into the Illinois high-risk pool. Played by the rules, done what she's needed to do. Is she being helped by this new health care law? Not at all, and she's feeling cheated. She went on to say, it feels very unfair. It goes against the spirit of what health care reform was supposed to be, said Kramer, a self-employed writer and owner of the Full Moon Marketing Communications. He said, this does seem like a low blow. Well, the members of the Senate voted for this bill that now someone from Illinois is saying she feels a bit cheated, feels very unfair, seems like a low blow. The existing program is called the Illinois Comprehensive Health Insurance Plan. 34 other states have similar programs. Well, by state law, people in this Illinois program pay 25 to 50% higher, more than standard rates. So they pay their premium, they pay every month, they continue to pay, and yet they are feeling cheated, they feel it's unfair, and it is a low blow. Well, even the Illinois Department of Insurance, their director, understands this lady's frustrations. To even the playing field, the director said, the state legislature would have to act to reduce the premiums. Can't rely on Washington. Illinois expects to receive money from the federal government to start the new high-risk pool. The insurance department says that there might be enough money to cover about 5,000 people in the new plan. Well, how's that compare? Far fewer, according to this article from the Peoria, Illinois paper, far fewer than the number of people who may qualify. A Government Accountability Office report said about 218,000 people might be eligible for a high-risk pool in Illinois. Well, what does the Illinois high-risk pool website have to say? They sent a letter to the enrollees, the people that play by the rules who've been paying their premiums month after month, and it says it's unlikely that the federal funds will be available to reduce premiums paid by the current enrollees, by the people who played by the rules and have continued to pay the bills. Now, they didn't actually send out this letter. They put it on their website. They wanted to send it out, but the reason they didn't is they said they didn't have the $5,000 for postage to send this letter to the people who have been sending thousands and thousands of dollars into this high-risk pool every year. The director said, no, we haven't mailed the letter because the cost of mailing was prohibitive, given that we have at this point not received any actual funding. He said it would be inappropriate to withdraw funds to send such a letter. Well, Julie Kramer was shown the letter on the website. She says, you know, I did feel a little flash of anger and disappointment when I read it. So I would say to the Secretary of Health and Human Services, who writes a letter to those in Washington via Politico, who said we are doing what we can to make sure that we are helping these people, the people of Peoria do not agree and do not believe what you have to say. And that's why, across the board, a majority of the Americans who need health care, who are concerned about the cost of care, look at this health care law and believe, in terms of a law that this Congress has passed, this President has signed, it is going to actually make the cost of their own care go up and the quality of their own care go down. And that's why overwhelmingly the American people have rejected this health care law. And that's why I come to the floor today, again, Madam President, with my second opinion. And my opinion is it is time to repeal this law and replace it. Replace it with solid ideas that will help people lower the cost of their care, improve the quality of their care, and increase their access to care. And that would be patient-centered health care that allows people to buy insurance across state lines, that gives people who buy their own policies the opportunity to get the same tax relief that the big companies get, to provide individuals incentives to stay healthy and get the cost of their care down by lowering their risk factors for disease, because half of all the money we spend in this country in health care is on just 5% of the people, who for the most part are people that eat too much, exercise too little, and smoke. Things and solutions that deal with lawsuit abuse to get down that cost of all the defensive medicine, Madam President, that is practiced in this country, and allow small businesses to join together to provide less expensive insurance for those people who work for those businesses. Those are the things that we know will work. Those are the things that we know will be able to allow us to deliver higher quality of care. Those are the things that will allow us to lower the cost of care. And that is why it is my opinion as a physician who's practiced medicine since 1983 that we need to repeal this health care law and replace it with something that will work for the people of America.